I am Mr Efstathios Drampalos, and I work as a foot and ankle and trauma surgeon at Spire Edinburgh Hospitals, Murrayfield and Chauffeur Park. I also work at Kings Park Hospital in Stirling. For the NHS, I work at Forth Valley Royal Hospital, and I'm the chief foot and ankle surgeon there. Finally, I am an honorary senior clinical lecturer for the University of Glasgow Medical School. Well, as a child and then growing up as a teenager, I was always very active. I was an athlete. But I was also frail, so every now and then, frequently, I would end up in minor injuries or A&E. And for me, it was a very familiar environment. My mom was the senior nurse of the A&E, so I get used to the idea of being there, being treated. And as I was growing up, I understood that it would be nice to know what's happening to me, and then why not help others? And then orthopedic surgery has sports injury included, and I like sports. I also was always very good at school. I want the best, and then high school, and I realized you have to be very good at what you do, meticulous and smart, in order to help others with their problems. So I suppose I always wanted to become an orthopedic surgeon before even I wanted to become a doctor, but it came quite naturally for me. I think that's very common for many of the doctors. Yes, foot and ankle is fascinating. First of all, it's complex. The biomechanics of foot and ankle are complex. You have so many little bones and bigger bones. So the decisions that you have to take and the options that you have really to be tailored on each patient. Frequently, it's a combination of procedures that needs to be chosen and adapted to each patient, which makes foot and ankle fascinating. Also, there's a lot of sport injuries involved in foot and ankle. We deal with people or athletes who have had sports injuries, and you have the opportunity to be involved in treatment of these patients, which is fascinating. There's a lot of trauma. The tibia is one of the main exposed, let's say, bones of the body, which frequently is traumatized in injuries. So there's a lot of traumatology in foot and ankle, and I like the unpredictable trauma that comes to you and the dealing with it. And finally, you can give solutions quickly to the patients. A simple platelet-rich plasma injection on the plantar fascia can help deal with a problem that hasn't been solved for years, or the right combination of procedures can help significantly a patient, or even not doing anything and giving insults. So there's a variety of options which you can choose and personalize your treatment to every patient. But finally, and that's a very, very important for foot and ankle, the foot and ankle community of doctors are really pleasant compared to other, probably a bit more boring subspecialties. There's always fun, humor, laugh, and food. So it's quite enjoyable as a subspecialty. The fact that I can help others, either with an operation or with an advice, not only as an orthopedic doctor, but as a doctor, I can help them understand what they have, direct them, The same for myself. I can understand what's happening to me or look for the right advice. So as a doctor, one of the best things is that you can understand what's happening to you, your relatives, your friends, your neighbors, and you can help people to find the right solution. And the best moment when I'm really happy is not when I see the patient, because it's when the patient comes to me. That's when the patient comes to me with a problem. It's when I discharge the patient and I don't see the patient again. But when I discharge the patient back to their normal lives, to their family, the grandkids, their kids, their parents. So it's really rewarding as a person, as a professional. It's very challenging. You have to keep studying, update your knowledge, learn from your mistakes, learn from the mistakes of others, communicate your knowledge, and update your knowledge, then learn new techniques. I think medicine is really fascinating, and gives you a big reward, both as a professional and also as a person. And most of it is the most important reward that you get is this feeling of satisfaction and feeling of achievement that you've done something really good.